Good afternoon, everyone, and welcome to our WITS Imagining Innovation series. This afternoon, we have another interesting lineup in a series of talks entitled A Domestic Revolution, City Life in a Pandemic. We have two amazing speakers who are going to enlighten us on a large number of issues that I think are relevant in today's discussion. And on behalf of the Department of Family Medicine and Primary Care, we'd like to welcome you. Please note you can post your questions in the chat, and we will take those questions after both speakers have spoken. So this afternoon session, we're looking at how the COVID pandemic has impacted concepts of space. And we are looking through City Lockdown Diaries during the lockdown period to get a unique vision on the challenges that affected residents during this time, especially in areas of informal settlements. One of the predictions during the COVID pandemic, or at the beginning of the COVID pandemic, was that people living in informal settlement would be overwhelmed with COVID due to the overcrowding and the inability to socially distance. Yet evidence has shown that this hasn't been the case. So today we have, as I said, two excellent speakers to discuss some of the peculiarities of these spaces and the implications of such. Our first speaker is Dr. Ngaka Mosiani, who's a senior researcher at the Gauteng City Region Observatory. His object of his study is the Gauteng City Region, especially its edges and adjoining areas. His research interests include the history and major dimensions of informal housing and its future directions in theory and methodology. Ngaka, over to you. Ngaka, unmute. You're muted. There we go. All right.
So my talk is not directly addressing the COVID issues during the pandemic per se. It is largely sort of like on the innovation side, imagining innovation of what can actually be done, whether structurally in terms of the shacks or in terms of spatial planning around the shacks, but these things actually extends to other parts of the city or other rural areas. So it's not just confined to the shack. So the other speaker will speak about issues that pertains to COVID in much more direct ways. So quite a number of us in South Africa live in informal settlements. It's not a small number. Actually, according to Edgar Peterson, 62% in African cities, people live in informal settlements. And the issue of informal settlements comes a long way with us. During the post-colonial period, just after independence of countries in the developing countries, in the developing world, the issue of public housing could not accommodate everyone. And by the 1970s, International Finance Organization came up with funding and tried to make intervention through what they call like the site and services schemes. That could not solve the problem. By the 1980s, a new intervention was in place called the In-situ slum and squatter upgrading. So we are actually having this thing that's really gonna stay with us, it looks like, for quite some time. And my talk is around what can be done, whether planning or structurally. And I'm not gonna be able to cover all the material that I have. I have a case study in Mshiniwam, Joslovo informal settlement in Cape Town that I'm not going to be able to, and the other one is actually quite interesting because it covers both the structural elements of the shack and also the planning aspects of it in terms of like spatial planning. What is actually very important about some of the things that were said during the pandemic, when you really like the public discourse, the public debates, was the way in which informality, especially informal people living in informal, this kind of conditions in informal settlements can be vectors of mortality. This specifically has to do with the lack of infrastructure around basic services. And a lot of you in the audience would know much more about the diseases that actually can be caused by lack of access to water, solid waste, or sanitation. When you don't have problems, what can really go through it? But for me, also, the other thing is about location, where these kind of places are located, whether you can be talking about the floodplains, which it will come up with its own other problems, or the mining or post-mining landscapes, it will come up with disease-related problems in those areas. We can talk about steep slopes. I'm looking at it in terms of like the global south scale. You might say that COVID was not quite high in informal settlement, or it's actually still not high in informal settlement relative to other places. But I just want to draw your attention to the fact that the GCRO quality of life survey that we just completed and launched a few months ago shows that actually amongst Black Africans and what used to be called like coloreds, maybe still, we're putting here for the sake of research to be. So you realize that the rate of infections were quite high. I mean, are low, also because of inability. Let me just move this thing. The inability to be able to access testing, for COVID. If you look at that from the income level, the same still holds. If you look at the highest income group here, the being denied to test is very low, and also, although infections are quite high, but then there's a new element also that we have a low issue of accessing healthcare facilities. So I'm just leaving it out there that we might have not seen the high numbers of COVID in informal settlements, but there are some of these issues that might maybe be able to tell us why that could be the case. So I just wanted to focus for my talk, which I'll not be able to cover these two issues, the two themes of spatial design of these areas, and like I said, beyond informal settlement, these things are sort of like new ideas that are out there. But I must say that actually they have been heightened by the pandemic period. They've been there before. Structural design, of course, also of a shack to try to make the shack livable. Like I said, this problem of informal settlement come from a long way. So the issue now is really to try to make look at even the material of the shack itself to make it more livable. So I have a case here of Rustenburg, Phokeng, where in the early 2000s, particularly influenced by the law that where this mining charter said, people really from the mining companies to the Bafokeng administration, just local managers and business people started to discuss the issue of housing. And the Bafokeng administration appointed Joshua Kamarov to come up with the architectural language of the settlements in the Bafokeng area. But then after that, there's the issue of physical representation of that architectural language. And then a Singaporean-based company was appointed to come up with ideas around that, and also a South African-based firm called Architecta SA. So these are some of the ideas around what can be done on space to try, of course, to intervene in social, economic, and other issues. But my point here is that this can actually be very important in case of health issues, and it will become a little bit clearer as I move along. So both the Architecta SA and Joshua Komarov drew from the pre-colonial sort of like African space-making traditions, but also from international space-making values, open, contiguous kind of space. Some of these principles, continuity between the interior and exterior, modular growth, and economic sustainability. So all of these were brought into really practicality by someone called Bridget Horner, who actually brought it down to the level of the street. So my contribution is really around the street model in terms of as a basic building block of a place, as opposed to the block model, which was brought into the discussion into play by the Singaporean consultants that I've identified earlier. So I could go, if I had time, into trying to explain this pre-colonial settlement in the Rustenburg area. This is the Babakwena. Archaeologists have done quite a lot of research in this space. So focusing on the street model as a structuring component of place, as I said, mainly really crediting this to Bridget Horner, building on Jojo Komarov and Architecture SA, is that the street, shapes the identity of a place. This has got a lot to do with the economic side of things, okay? And then the walkability and accessibility of the street by vehicles is also very, very, very much important, because then together with the building facade, there is that conditions created which are very much organic for socio-cultural and economic activity in the area. So what has become very, very important in terms of health is the building facade, okay? And the street itself, their outward facing perimeter, that outward orientation. I'm thinking about it along the lines of ventilation, of the kind of structures and buildings that are built where things are not necessarily contained. Maybe, for example, if we were to follow the block model. So remember, here we're on the street model. So although we are on the street model, but also, we're thinking about a much larger space where now the building facade on the street becomes that interface between the local and the visitor, between the local and the outside. More practically, we're looking here on this side. It is the same thing what you see on the left. It is that a village called Pokeng. We have the mall there. We have the stadium here, the mall here, the stadium here, and the civic center. So there are areas here. So what is happening in this area? There are a number of economic activity going on here, home-based. Okay, so the street model will help to unlock this, because when you look at this road, it is sort of like a provincial road. The way it is built, it is not that easy to be able to move out into the streets as and when you want. So the street model is to try to replan this area in a way that accessibility, both by cars, that can really be facilitated for economic activity, but also, like I said, for, when things are on the street, it becomes much more easy to control things like ventilation and so forth. I mean, I think this thing is a little bit much more complex. So for you to understand it, it is now that block model, and this is what they came up with. So here we find that stadium that we saw earlier, and then I'll go back to that map. So the stadium is here, and then here is that shopping mall, and then that other area is over here. So the block model was basically introducing, if you like, a new city from the scratch, which is very much removed from where the people are. And then what becomes very important about this, its inward-looking nature. There is vitality social, there's an interaction, but it is inward-based. So my contribution is to say that using the street model allows for a particular kind of building configuration, spatial configuration, where economic activity, socio-cultural activity can continue even during a pandemic, because especially if you want to look at issues of ventilation. How am I doing with time, Dr. Mutara? How much time do I have?
You still have another 2 minutes, Naka.
Okay, so pretty much that's really where I thought I wanted to contribute. But maybe moving to the structural side of things, because it looks like time allows. So the city of Joburg also received proposal from architects and other people suggesting on how the backyard accommodation in the townships be transformed, be transferred into the housing landscape that can be subsidized by the municipality, by the state. And then here the issue is the use of the materials that people are already using. Because remember, even now we are doing the RDP housing, they're still not able to house everyone. So the issue here is to try as cheap as possible to take the existing material that can be quite reasonable. So one company, single open plan, they came up with this. Another company, precast wall panels, roof sheeting. Okay, I didn't get the pricing for that. But this thing tend to be quite cheaper, and at the same time, they are so people can continue living. You know, before that revolution, you know, that we can talk about from Marxist terms, before it arrives, maybe we can achieve this kind of revolution where people are still living in this kind of like spaces, but in a way that is a little bit more livable. You know, you can use like a shipping container, and depending on how much can be paid, you can come up with something like this. Yeah, so I guess I'll leave it there. Like I said, this is a bit of a long story. I have a paper drafted, and then on this Cape Town case study, it's really around both the structural aspect of things and the spatial design kind of things. Look at some of the things that they have suggested on the wall of the shack, which can help with controlling the temperature of the flag of the shack, but also sort of like bringing in like the greener aspect. So this dead space environmentally, all of a sudden it's becoming this a vibrant biodiversity kind of like a space. You can talk about even trying to bring in the light through just recycling things. I mean, even the way that thing is being altered is through like a used tire to use the drip irrigation in here. So look at how people have suggested the light. So I'm just trying to say that seeing just how far we come in terms of trying to intervene in informal settlements across the global south, there are ideas out there which I think the pandemic has really brought to the fore, and people can at least be able to live in somewhat livable environments. I mean, obviously there are issues about transport to the city, about jobs. There are other issues about basic services. But you know, those things are fully explained in the paper, because some of these interventions are actually like through institutional thickness, different people, including the city, being involved, providing services. So there is something here, I think, which caught me quite interested. Last year, when I was writing my other project on the peripheries, and realizing that the world through which I was writing on at the time has actually moved from underneath the feet of the people, and it would be insensitive for me to continue writing on that. And I focused on this, and I thought that the structural and especially the spatial planning can contribute to, in some small ways, to reducing the transmission. Thank you.
Thank you very much, Ngaka, for a very interesting and insightful talk. We'll take questions at the end. Just to tell you on a personal note, my first job as a qualified doctor was in Phuket, up in a GP practice opposite the shopping mall. So I do know what you're talking about. All right, so thank you for that. Our second speaker is Dr. Miriam Maina. She's a town planner, urban researcher, and postdoctoral researcher at the NRF chair in the spatial analysis and city planning at the School of Architecture and Planning at the University of the Witwatersrand. Her research work focuses on empirical documentation and analysis of urban life, growth, development, and policy making in African towns and cities. Thank you, Miriam, over to you.
Thank you very much, Dr. Feroza, for the introduction. And greetings, colleagues. Thank you very much for inviting me to present here. So I will just put my screen on display, and thank you for the introduction, so I don't need to repeat. But today I'm presenting the outputs from a collaborative research project that we undertook at the South African Research Chair during the level 5 lockdown in South Africa. And essentially what I'll be presenting today is some reflections on both the research method, but also on some of the data that we collected from this level 5 lockdown. So basically, as we all remember, in March 2020, when the lockdowns were announced, there was a lot of uncertainty that sort of swept over the country. as social media and initial reports began to show us signs that there would be, that people in different spaces and socioeconomic circumstances were going to experience a lockdown differently. So as researchers with background in the built environment and in civil society, what we wanted to do was to document and analyze some of these socio-spatial differentiations that would happen when the whole country was put in national lockdown. And our goal number one was to document this unique moment, but also to monitor and analyze this experience of lockdown across the province. So we had certain questions, for example, how would people living in different spaces and places across the province experience a lockdown? How would we cope with having to remain confined to our rooms, our flats, our houses, and our neighborhoods? How would our daily routines and activities change? How would different suburbs and areas and neighborhoods, for example, function and perform during this time? And so like the moment itself, our research project needed to be unconventional. And in the days prior, what we did was we just reached out to our personal, professional, and activist networks to recruit voluntary participants from different parts of the province who would submit daily diaries during this lockdown period of level 5. And what we asked was for them to send us sort of a voice note or a text message or photos or videos on WhatsApp narrating what they were going through, what they were experiencing. And the entries could be as broad or as specific as they wished. But all we needed them to do was, for example, answer 2 key questions. Number 1, what did I do today, or what did I observe? And within the dictates of the university, we deployed the research rapidly, but also tried to ensure, we ensured that the clarity and consent of participants was achieved in adherence to the ethics guidelines. So for example, it was an informed consent to participate in the process, but also that we would get the authorization if we were going to share something on social media, on our Twitter page or something. So we were trying as much as possible within the confines of lockdown to ensure that we were respecting the participating people. And so what we got, we also asked participants to fill in sort of 2 online surveys between March 27 and April 30th. And in the surveys, we were trying to ask different questions around the quantitative and qualitative information on where they live, the kind of household they were in, the size and the shape and size of the unit, some of the living conditions, for example, access to services, access to yards and balconies for any form of open space, neighborhood characteristics, the sort of policing they were witnessing, and whether they were able to access essential goods. And the 2 surveys were then refined and restructured into a larger survey, which we deployed to the general public and circulated through online platforms. And the point of the general survey was to provide us with additional data, but also to more or less corroborate or challenge some of the findings we were having from the diaries. So the map I'm showing here shows in red squares, the 23 diary respondents who volunteered to participate, and in the sort of purple dots, the general survey respondents. And since it was deployed online, we could see, for example, we had a lot of suburban responses, especially to the online survey. So some of the findings we were getting were giving us more of the image of the experience of lockdown within the suburban areas, but we also had some good coverage from inner city respondents and also from the different townships within the province. And by the end of the 5-week lockdown, we had received 334 diary entries, of which 127 were voice notes. And what we really appreciated from this was that they provided us with a thick and rich narrative of daily life during this very unique moment. And as we all have come to realize in the months since, the experience of lockdown was shared across different types of neighborhoods and areas. So there were some commonalities irrespective of where you stayed. But at the same time, when we began to analyze some of the diaries, we could see there were notable differences, especially across areas and depending on household. So we don't have a lot of time in today's presentation, but I will sort of capture some of the notable aspects that we came across. The first, as we have all come to know, is that a one-size-fits-all lockdown appeared quite out of step with the different kinds of housing arrangements and household and neighborhood characteristics we have, both in South Africa, but across the world, but especially because of the possibility of accessing essential goods and services or transport and how the street functions depending on neighborhood. We could see, for example, that the hard lockdown was more practical for residents who had private vehicles and could move from place to place to do some shopping. and who also lived in freestanding houses, mainly in the suburbs, where they had access to private yards and gardens in case you needed sort of a breather. For diary entries from residents from the inner city or from flats and apartments and suburban complexes where the outdoor space was limited, we could begin to glean diaries where participants were experiencing heightened feelings of feeling trapped or claustrophobic, and therefore driving their cars or just going somewhere became almost a reprieve. But at the same time, in the inner city, for example, the constant and confrontational presence of police severely restricted the movement of people and raised fears of participants, because we could almost begin to tell that in the inner cities and the CBDs, even the incidences of which you observed or you saw a police car driving by, or police sort of trying to stop someone, were higher than, for example, in the suburbs or even the townships. So this fear was experienced more, and you could see in the diaries the inner city participants expressing their concerns about having to go to the shops, not necessarily because they witnessed something or something happened to them, but because of what they could see outside their windows, for example. In contrast, participants from townships and informal settlements where streets are normally central to neighborhood life and where policing and surveillance was intermittent, we received more diaries of observations of children playing on the streets. Some were concerned why the children were not at home, but also that actually the size of the private yard that is provided for the unit is not sufficient, so the children would sort of spill over and play on the streets. From township participants as well, we noticed a higher prevalence of longer queues and waits for groceries or welfare grants, which to us were indicative of a mismatch between the kind of commercial and economic services that are provided in some of these suburbs and the number of residents within neighborhoods. So from a township diary, you could see someone saying, I went to do some shopping, but I had to queue or I had to wait longer to access some essential services. And such diaries would not come up from, for example, suburban participants. And on mental health, the challenge of mental health and anxiety was also rife and evident irrespective of area. And as later research has come to emphasize, the range of challenges that were created by isolation, by confinement, and restricted mobility were continually shared irrespective of where you lived. And they were linked to anxiety about the virus itself, but also about the effects of the virus on people's lives, on our families, on society, as well as on work and livelihoods. So that was a key feature that we noticed irrespective of where people were sending their diaries from. And on urban living, so I think one of the reflections we want to share today is actually on the experience of coming or designing such a quick research that really provided us with sufficient and rich information that could not have been collected otherwise. So academic projects usually require months of planning and preparation, but the level 5 lockdown offered us an opportunity to design a brief and nimble project that still adhered to principles of responsible research. And with the generous input from participating residents, we were able to really deepen our understanding of the interlinked effects of space and place and public health interventions, such as a national lockdown, on the day-to-day lives of individuals. From our analysis, we could see commonalities across different types of neighborhoods and the opportunities and shortcomings of different forms of built environment formation in such a moment. So we have been able to package some of the findings into some of the reports I'm displaying here, but also some sort of creative outputs such as videos, infographics, and academic research outputs. And these are corroborating some of the findings and analyses that have emerged since, which highlight that the social, the economic, and the psychological impact of national lockdowns on individuals and households, not just in South Africa, but across the world. And we hope that some of these outputs then would feed into some of the interventions and design things that are coming out from project teams such as the GCRO and so on. But thank you very much for your time, for allowing me to share our work with you.
Thank you very much, Miriam. I think that was very interesting. I think particularly for us as healthcare workers, you lose touch of the human side of people's feelings and how they actually react to these situations. So that's very, very insightful research. The other thing I wanted to say was those were stunning paintings in your presentation. So well done. Okay. Are there any questions? I don't see any on the chat. There's a comment from Nabila to everyone who said, love reading these diary entries. So insightful. Thank you for sharing your work. So well done on that. Kath, any questions? I don't see any on the chat. I have a question just to both Ngaka and to Miriam. One of the, we keep looking for reasons why COVID hasn't been as bad in terms of patient numbers and deaths in South Africa as it has been in Europe and in America. Now, I know there's some genetic studies that are going on and predisposing factors. We have a significant burden of comorbidities in our population, and that's increasing. Is there a reason from your points of view why we haven't really seen those numbers in South Africa, particularly, as I said at the beginning, in our informal settlements where we looked at overcrowding and difficulty, with social distancing and those kinds of concepts, which are absolutely impossible to implement in an overcrowded informal settlement. Ngaka kind of touched on it when he talked about one of the possible reasons of the numbers not being as high might have been the fact that people couldn't access testing and the relevant healthcare. But do you see any other reasons possibly why that was the case? Ngaka and then Miriam.
Thanks, Dr. Ferrer. No, not really. I think for me, those are the ones that I can put forward. Especially, as I said, my major focus is really around issues of space and sort of like how that can actually contribute. So I didn't really look specifically at the experience of COVID as such.
Miriam, any feelings from you?
Thanks for that. I think I would also be very interested to find out what the eventual findings are, but I would lean with Dr. Ngaka that it was something around maybe our rate of testing, but also we shouldn't underestimate the implementation of sort of public safety measures such as the lockdown. I think they did help sort of curb some of that transmission, but I would also not know because it was not my area of focus particularly. So I would be curious as you are, yeah.
Yeah, thank you. All right, so there's a question from Anna Marsh. Are there clinics and health facilities that we know of using this new building technology? Ngaka?
No, I haven't really come across, reading or seeing anything beyond the, the household structure itself, where people live. I mean, I'm very much dying to get to Mshinwam, informal settlement in Cape Town. I haven't really been there myself. I'm just reading stuff.
Interesting. Yeah.
So it would be quite nice. Perhaps there could be like some innovation beyond the household structure.
I think it has very much relevance, particularly if we're looking at taking healthcare to a local level. Where we're decentralizing it from hospital levels to, for example, a patient that needs to come to, Charlotte to collect medication, whereas they could be collecting their medication at a little clinic in the area, even if it's a small little container kind of setup, where they could be, in terms of saving on transport and, getting to and from a hospital. All the logistics involved in that process would be so much less and cost saving for the patient if they could do that. So definitely something to look at. There's another question from Agnes Smolly. Have we seen people use green recycle technology in home building by themselves? So using green materials such as plants at all in the Gauteng area?
My answer is no. I haven't seen that. I know there's a lot written from the spaces like where we are. People in universities are writing about all kinds of things. And as I said, some implementation has been done in Cape Town, but in Gauteng area, I am not quite aware of it, except credit to the city of Joburg. The material that I was showing you, that table with 9 submissions, was really an initiative from within the city to really begin to utilize some of these materials with the city subsidizing this backyard accommodation. This was like somewhere around 2015, 2014, and I'm not sure if that project finally took off. But at least what we can say is that the ideas are there from within Gauteng. I think it's just, I don't know actually what's the hold up.
Okay, probably money as it usually is, but we'll get there, I think. All right, so there's a comment from Prof. Lucia Annalie. According to the MRC, there are around 250,000 excess deaths in 2021, of which they believe 2/3 are attributed to COVID. And these have not been reported as such. So our real numbers are probably higher, and I agree with that. There's a comment from Moatue Tori Pizze. Great presentation. Thank you both. Dr. Mosiani, any chance in future that this research could be participatory to pick up insights from participants?
Yes. I mean, it's a pity. Like when I was introduced, my object of study is Gauteng. You know, I'm employed to do that, to focus on Gauteng. But I think really for best practices, I'm really going to start in Mshiniwam in Cape Town to observe what is really going on there, what I've read, but also to speak with the people and get their insights. Because actually already when you read around what is already there publicly, you can actually already hear the voices of the people. This process in Mshiniwam was very, very much participatory. It was not really a top-down kind of a thing. Actually, it is being used across, I think, the Western Cape as sort of like an example. And I think it has been rolled out, you know, with the city being involved there. But I'm not really sure about its success or how the assessment outside of Mshiniwam informal settlement.
Stephen Penn says, pandemics make visible the social fault lines in society and exacerbate social and economic inequality. The issue of poor access in informal settlements is a prime example. Given that we have to live with the reality that informal settlements are here to stay for the time being, how could we better use the discourse of social determinants of health to shift housing policy and interventions? Miriam, any comments on that?
Yeah, that's a very useful point. I really agree with you, Stephen. And I think these are some of the points that Dr. Ngaka is making, that once we have a sort of a crisis or a situation such as a global pandemic is when we have to realize like what kind of settlements we have. If it's a planning community, what kind of settlements we have allowed to happen or not intervened in very quickly, and what do we do about it? But in terms of forward thinking, I think one of the most critical things would be arguably to use what we have learned from COVID and how we may not have enough resources to provide whatever housing solutions we intend to provide as a government. But nonetheless, we can do we can inject a lot of interventions into the community as it is. And I think one of the strong wins would be to link housing policy interventions with some of the ideas that are sitting, for example, in planning, which unfortunately, or infrastructure investment, which unfortunately are sort of separate mandates, because planning would only maybe advise on how we can make settlements livable and make sure that everyone has access to a critical set of services at least. And then some of the permeability and accessibility and the restructuring of the settlement that Dr. Ngaka was presenting. So whatever housing investment we can find resources for, let us put them in the settlement that has already been moderately improved. So if we were to synchronize planning ideas with housing money investment, we can really transform the settlements while we wait to build the houses or whatever it is that housing policy is trying to do. But it requires some different ways of intergovernmental coordination.
Yeah, no, definitely. Comment from Charles Pettigill at UP. Has there been any uptake of the use of cycles or bikes in townships and informal settlements during the pandemic, with much lower traffic during the periods of the lockdown? Do you have any insights, Dr. Ngaka?
Yeah, I think there's a generalized observation from the quality of life on that particular, transport issues in general, what happened during the pandemic. I mean, from what I can remember from that survey is that moving to like shorter destinations, like that are within, like, I don't know, 15 minutes from home, increased quite a lot. So walking, it looks like went up quite well. Went up, but cycling, I doubt. I don't think there is an uptake in that, given just the conditions of our roads. I mean,
also would depend on whether they have access to a bicycle or a bike of any sort. Dr. Maina, in your study, has there been any trace of state violence as a concern?
So I think what we did not necessarily measure that. What we were trying to ask residents was to report to us whether they'd spotted any sort of police vehicle or army or private security driving around their neighborhood. Maybe what was the frequency of coverage in your neighborhood? So what we did find was, for example, in some of the inner city areas. Also, I think what I want to add here is the imagined from what you see on social media. So people would share all these photos of sort of army trucks and raise sort of the communal fear. But all we could report on was, for example, in inner city, there was a higher frequency of coverage or surveillance or driving around by police specifically. And in the suburbs, you could see more private security were the ones who were doing more of that moving around, but not necessarily violence. Although some of the diaries would say, I did see some police sort of talking to someone or asking someone to go back in, or maybe getting a bit physical with that. But it was reported at an individual level, not as like week by week or observation. Yeah.
Okay. All right. While we'll stay there, Dr. Maina, were researchers from different disciplines involved in your project? And if so, from which disciplines? From Anya Bedeka.
Thank you, Anya. So yeah, what we were very excited about was to try and work with as much of an interdisciplinary team as we could invite during this very quick study. But what we did was we had mostly students from planning and architecture. So some of the sketches that I was sharing with you were done by our collaborator, Kahiso Diale, who is an architect, who also does art and so on. But yeah, we didn't get as big a spread of interdisciplinarity as we were going for, but we did try to capture as many team members as we could, and we got planner, architects, and geographer team members within the chair. So that's what we did.
Okay, thank you. All right, a comment from from Jerome Chetty. Dr. Maina and Dr. Mosiani, can you comment on the provision of cellular and internet access and linking network capacity into the poorer communities of South Africa as an infrastructure right, linked to housing, water, and so on? And how does your research speak to this? Dr. Ngaka and then Miriam.
Yeah, so cell phones and internet as a right. I mean, I know that within the GCRO through our quality of life survey that we do every second year, the issue of connectivity in broad terms, whether you're talking about transport and access to phone and internet is actually a very important issue. And I would think that what comes generally from that is that the access to both of them are actually quite poor, compared to maybe, for example, as we move to the core parts of the cities in Gauteng. So I mean, I think it's a very interesting question about the right. I mean, what I can just say is that I know the city of Tshwane, some years ago, it used to have a citywide Wi-Fi access.
Wi-Fi, yeah.
Something like that. It was provided. I'm not sure how good that was, but it looks like it was a way to go. And a few days ago, I think I must have read or heard something that it is now discontinued. It's no longer accessible. But I think it could be seen in that light. If you start to see municipalities beginning to provide it, we can talk about the quality of that. But it looks like because already there's something in that has been started, it can go to those aspects of right of access.
I agree.
Dr. Miriam, any comments?
I agree 100% because I think most of the big metros are beginning to install sort of public internet within their municipal amenities. So if it's a library or community center, then it will be a Wi-Fi zone that the community can access, which takes me to what was my presentation earlier around the population to services ratio, because if then we were, and you could see how access to internet became critical, not just for economic, but also for education during the lockdown. So then you're saying, do we have enough Wi-Fi points in this community that everyone would be able to have access to at least sufficient internet? And if we look at internet, not just as a favor we are doing the community, but actually a way for the community to reach the government. So there's a new form of public participation so that we can actually begin to build some of the tools for linking citizens to government through public or through cell phone or through cell phone apps. So then it is a right that the government should take on to deliver these services, I think. And that's much more than more of a personal opinion, actually.
Definitely. I think it opens a whole world of access to so many entities, just having that internet access. All right, so our last question, History Han, student from UP. Thank you for these presentations. What's the possibility of local health committees being set up again, like we saw in the early to mid 20th century in places like Alexandra in Joburg and Edenvale in KZN? It says, see the book by Mark Eprecht, and housing, sanitation, and local studies were key. Any comments on that? Dr. Masanya?
Yeah, I thanks for the reference that you have just read, and that was given. I wouldn't say that from my experience of Rustenburg that there would be local committees on that, but it is actually quite interesting that, as we understand that it is the South African government at various levels that provide health services, but it's actually quite interesting to realize that even in that area, in the Bafokeng areas in particular, the local Bafokeng administration itself is actually providing infrastructure, but also a layer of human resource on that, who are actually employed by the Bafokeng, paid by Bafokeng, to really complement what the state is doing. So it's not really going down. I'm not sure whether it really goes down to the level of community, kind of like coalitions, but at the level of the local state in the Bafokeng administration, it does actually happen.
Yeah, I think it's a challenge, and more local communities and private entities are sort of clubbing together to provide those services that are not forthcoming for whatever reason. Okay, so there's just a last comment here for Dr. Mosiani. How significant would the unlocking of land be on these spatial reconfigurations, taking into account that there may be a country, that we may be a country with low aptitudes and inclinations to innovation, radical change, and reconfiguration?
I think she's muted. I mean, she's freezed.
Yeah.
The network was lagging.
Okay. Miriam, did you want to come in there?
No, I think Dr. Ngaka can take this question, but I do believe, that just by unlocking the land, then you can open up a lot of opportunity for creative intervention. But Dr. Ngaka, this is your research question.
Yes.
Yeah, I mean, it's a very important question, given that, you know, that Puken case study is within the context of a tribal communal land. So there's a very important need to unlock that, because if you look at those kind of like the entrepreneurial activities that I kind of like implied, where are mainly household based, whether you're talking about tuck shops or taverns or many other things. So I think there's a general thing that I'm beginning to think about, and I've read it in when you look at in urban studies in geography, Professor Jenny Robinson, you know, talking about how we need to think about some of these things in ordinary terms, rather than what we tend to do in terms of thinking about, in, you know, African city. You know, Joburg is like an African, global African city, something like that, which tend to actually only favor certain kinds of participations. But once we start to look at things in ordinary terms, you know, sort of like modernist standards, and just the way we control land management can be ordinarily and then open up to the people. But that's not really what is in the minds of local planners, I must say. This is a very important question, because local planning is thinking more in modernist terms, rather than really embedding things to make sure that it opens up for broader participation.
Yes. Okay, and then a final comment from Keith Burns. This history comment made me think about the role of Gift of the Givers. Was this NGO visible in any of your work, Dr. Miriam? Any impact that you saw from NGOs like Gift of the Givers?
So in the diaries, two of the diary entries, one in the inner city of Johannesburg and one in sort of in the south in Mansfield, did report that NGOs were either coming to check in on communities and to check in on households, like door to door. So one of our participants was an NGO member, but it wasn't mentioned that it was Gift of the Givers. But definitely during level 5, there was NGO activity, both trying to check in on residents from door to door to see what they needed and to provide some of the services, but also to do some of the health support during level 5. But that would have come up in the diary, not at scale, at a citywide level.
Wow.
Capture that.
Yeah. All right, thank you so much. We've reached the end of the hour. As usual, when you're having interesting discussions, time seems to go too quickly. I'd like to thank Dr. Ngaka Musiane and Dr. Miriam Maina for their excellent talks and insights into a very South African relevant issue in terms of informal settlements. And I think they're here to stay, so it's how we work around them and how we incorporate them and provide the best possible environment for people living and services for people living in these informal settlements. Thank you very much to the team that put together all the organization and coordination. And thank you very much to all the participants and the colleagues that have joined us on the talk. Stephen, do you want to flight the topics for the next session, please? There we go. So the next session is on the 24th. Oh, okay. The next session is on the 24th of November, the same time. The so-called Anthropause, Reconsidering Origins and Environments. And looks like it's going to be another interesting set of talks. Thank you very much. I think we've reached the end of our session. Thank you very much and goodbye, everyone.
Thank you, Dr. Feroza. Thank you, everyone.
Thank you.
Bye.